Let's think about policing differently as we try to address an issue of safety, which every community deserves. Does that make sense?
It does.
Well,
Joe, take it.
Well, but the thing is, you talk about.
But the thing is, this may actually be the moment where Joe Scarborough rips off his mic, his lapel mic, stands up, pushes his chair in, flips the bird to the producers and says, fuck this shit, I'm out. I quit. I don't want this job anymore. And Vigilant Fox says, whoa, Joe Scarborough just went toe-to-toe with a Princeton elitist professor trashing Trump's crime crackdown and walked away with the win. There's still a Republican in there somewhere. However, deep down it may be. And this brings me back to the historic win, November of 2024, President Trump, president-elect. And who is the first to reach out and extend the olive branch and ask for a visit down to Mar-a-Lago? Joe Scarborough, Mika Brzezinski, Morning Joe themselves, begging, pleading for what we don't know exactly. But based on this and based on, I'm trying to remember the last instance that Joe Scarborough in like the last week pretty much went to bat for America, for Trump, for MAGA, for conservative, patriotic Republicans that want to see this country improved and not further pushed down, deeper down this dark hole that we're in. Joe Scarborough may fall into the same category of Mayor Eric Adams and Senator John Fetterman as potentially, and even Bill Maher, switching sides based on what we are about to see and what I'm about to show you. So there's that. Now, there's that, and there's also this. And thank you all for the love and support. Without you, none of this would be possible. Every donation, super thanks, sent through YouTube, memberships here and on Patreon keep us going. Hopefully taking this show on the road here very soon and bringing our voice to you and making an impact for what is to come. Because our fight isn't over, even though we're truly blessed and winning every day that we wake up and touch ground. And it doesn't matter if you're in California, Texas, Iowa, Florida, New York, or Kansas. We're all in this together. And today, I want to talk about something that affects so many of us and our loved ones, Medicare. Folks, the Medicare enrollment period is right around the corner, and I cannot stress enough how critical it is to take action now. Whether you're new to Medicare or already enrolled, these periods, like the annual enrollment period from October 15th to December 7th, are your chance to make sure you're set up for success. Waiting until the last minute or assuming your current plan is good enough can lead to costly mistakes that could haunt you for years, maybe even for the rest of your life on Medicare. And let me share a couple of real world examples to drive this point home. Imagine a retiree. Let's call her Susan from Florida. Susan thought her Medicare plan was fine and she'd be on it for years. Didn't want the hassle of reviewing it. But when she needed emergency surgery, she found out her plan didn't cover the specialist she needed. She was stuck with thousands of dollars in out-of-pocket costs. Now, if she reviewed her options during the enrollment period, she could have switched to a plan that covered her needs and saved her from the financial nightmare that she now faces. Then there's John from Texas, who procrastinated on enrolling in a Part D prescription drug plan because he didn't need meds yet. Yeah, when he was diagnosed with a chronic condition, he faced a lifetime penalty, paying higher premiums every single month because he missed the initial enrollment window. And these aren't just stories, they're warnings. And if you are interested in saving money, specifically on your Medicare, then make sure you give our friends at Chapter a call. And I want you guys to really, really pay attention here, because it's come to my attention that most seniors are not on the best Medicare plan. They're either overpaying for the same coverage they could get elsewhere, or they don't have the coverage they need in an emergency. Chapter can review your options in under 20 minutes. It's fast, it's simple, it's easy, and it's free. If you're already on the best possible plan, they'll tell you they're unbiased and they're purely here to help folks, seniors, save money on healthcare, on average $1,100. And if you're not on the right plan, they'll help you switch, even if it's to a plan that pays them nothing. Again, unbiased, folks. This is unique and unlike any other Medicare provider out there. And this is exactly why we love Chapter so much, because they're literally just trying to help people. Chapter works for you, not big insurance or the government. And there's no pressure, just honest, free advice from professionals who know Medicare inside and out. Delays or inaction during Medicare enrollment can lead to overpaying for coverage, gaps in care, or penalties that stick with you for life. And here's the truth. Most seniors are not on the best Medicare plan for their needs. And according to studies, many are even either overpaying for the same coverage that they could get elsewhere for less, or they're stuck with plans that leave them exposed in the event of an emergency. Whether it's a hospital stay, a specialist visit, or a new prescription, the wrong plan can cost you thousands of dollars or leave you scrambling when you least expect it. But here's the good news. You don't have to navigate this alone. You don't have to wait until it's too late. That's where our incredible friends and partners at Chapter come in. They're offering free Medicare help and consultation to make sure you're on the right plan for you. And you can reach them right now at the number that you guys see on the screen. At the number you see on your screen, 270-467-2426. And here's why Chapter is different. They work for you, not big insurance companies or the government. In under 20 minutes, their expert advisors can review your current plan and compare it against thousands of options available in your area. And if you're already on the best possible plan for your needs, then they'll just tell you, no strings attached. But if there's a better option, one that saves you money or gives you better coverage, well, they'll walk you through how to switch, even if it's to a plan that pays them nothing. That's right. Schedule a consultation, take control of your Medicare plan, protect your health, and save your hard-earned money, because you deserve peace of mind no matter where you are. Again, let me know, California, Texas, Iowa, Florida, New York, Kansas, or anywhere in between. Let's keep the momentum going here, folks. Share this message, spread the word, and let's make sure everyone we care about is ready for what's ahead. Again, thank you for being part of this community, and let's keep fighting the good fight together.
How cops on the streets won't make a difference. I will tell you that one poll after another has suggested otherwise. When you speak to Black Americans, when you speak to poorer Americans, there's a Washington Post poll that we've talked about quite a bit over the past several weeks since we talked about additional troops in Washington, D.C., and that is 91% of D.C. residents said that crime was a serious problem. The people that said crime was a very serious problem overwhelmingly were Black residents. Those who said it was not a serious crime predominantly were white, rich residents. And the demographic who said that crime was the biggest problem were Black women. I go back to 2020 when there were a lot of hipsters talking about defunding the police, a lot of political activists talking about defunding the police. You can find New York Times articles in real time about communities predominantly with people of color in some of the poorest and most dangerous parts of New York City. And their city councilmen and city councilwomen were saying, defund the police. What are you talking about? We need more police on the streets. We need more safety officers in our school. We need more police officers making sure our children and our mothers can walk to school and walk to work without being stopped by gang members. So I guess that's my question back to you. When you're speaking generally about this, are you speaking as an academic? Are you speaking as somebody who reflects these communities who say, we live in a dangerous city? I know rich white people in Georgetown may feel more comfortable, or in Northwest Washington may feel more comfortable, but in Southeast We don't feel more comfortable. We want more cops.
No, Joe, I'm not just speaking as an academic. I'm speaking as a black man who has been reared in the United States with a deep-seated suspicion about whether or not police actually are engaged in protecting our communities, right? Having had the talk, right, from a young man, from a young boy. So there's not this relationship to the police that you're presupposing. And let me just say this, I think.
No, I'm not presupposing.
Let me just make this point.
Hold on, Eddie.
Eddie.
I'm not presupposing anything. I am giving you data. And by the way, are you living the same experience that you're talking about, that we've talked about on this show for 18 years with you and Gene Robinson and everybody else? But is your experience in Princeton the same as somebody's in Anacostia?
Of course not. Of course not. There are class differences. There are class differences that complicate.
Let's talk about the person in Anacostia.